Hi, this is Dr. David Potts. Welcome to our Change Your Smile, Change Your Life seminar. You're about to discover how and why a transformed smile can literally change your life. Once a top secret of the rich and famous, dental implants are now available and affordable for most everyone. Why an informational seminar? To give you the necessary information needed to make an informed and intelligent decision on the numerous dental implant options. Have you ever wondered what it would be like to smile with confidence at the people you love? What it would be like to eat your favorite food at your favorite restaurant without pain and embarrassment? How it would feel to look 10, 20, even 30 years younger? Today you will learn the simple steps to having a new beautiful smile, the benefits of dental implants, why partial dentures don't work, why one size does not fit all, how to reclaim your smile and get your life back. There has never been a better time. Technology has never been better. The mouth is in a constant state of deterioration. If you wait too long, it could be more expensive or even too late. The two most common patient complaints are: 1. Cannot eat the foods they love or need for healthy nutrition, and 2. For once in their lives, they want to have a smile they will not be embarrassed about. Some common patient concerns: they don't know where to go, they don't know who to trust, they lack confidence, and they're ashamed of their smile. Missing teeth. Limit what we eat on a daily basis. Limit how we live our lives, both socially and emotionally. No wonder missing teeth affect our lives so much. After all, we use our mouths for many things every day. We eat, we talk, we communicate, we sing, we laugh, we kiss, we are intimate, etc. What are some of the things that happen to us physically when we lose teeth? We get bone loss, hyperextension of teeth, shifting of teeth, periodontal disease, changes in your bite, gaps between teeth. The sinuses can drop down, leaving no room for implants. It can cause TMJ problems. When we lose teeth, we lose bone. Bone loss is progressive. We can lose 40 to 50% of the ridge bone after only 6 months. It's irreversible. We get facial collapse, wrinkles around our mouths. We can have nerve pain, jaw fractures. The bone just keeps disappearing. Missing teeth cause reduced chewing ability and function. Dentures and partials only give us 20 to 50% of natural tooth function. This reduced function equals an increase in soft, starchy food intake due to the difficulty in chewing and biting. Dental fact. Studies show that people who are missing all their teeth have an average lifespan 10 years less than their peers with teeth due to poor nutrition. Missing teeth affect the way we live, dictate what we eat, affect how we feel, determine how people perceive us. So what's the answer? So what are our options? Fortunately, today's dentistry offers numerous options for the replacement of missing teeth. However, only one option, dental implants, has been determined to be the standard of care for tooth replacement in modern dentistry. What are dental implants? Dental implants mirror the structure of an original tooth. Why are dental implants the standard of care? Of all the different options that exist today, only implants can stop the bone loss, stop tooth shifting, increase bite power, and do not affect the adjacent healthy teeth. What's the history of dental implants? They're not new. The Egyptians used little rocks, shells, and gold as dental implants over 3,000 years ago. They started gaining popularity in the 1980s as success rates increased. Improvements in design and technology have decreased healing times, increased predictability. Current success rates are 98% after 10 years. Osseointegration. Titanium is easily accepted by the body, and the bone grows around specifically designed titanium implants in a process called osseointegration. However, one size does not fit all, and implants may not be the right solution for you. Let's explore all our options for replacement of missing teeth. Let's review some of our options for replacing a missing single tooth. One missing tooth. Partial denture, aka partial or flipper. Pros: it's most economical. Cons: it's uncomfortable, can irritate the gums, moves and shifts when we're eating, has food trap problems that can cause bad breath, the clasps can wear down adjacent teeth, leading to more tooth loss. They should be taken out at night. The lifespan is 3 to 8 years. Bone loss continues and function diminishes. A fixed Maryland bridge is another option. Pros: they're more economical, they're fixed, they don't come out. The cons: adjacent teeth may need to be cut down some in the back to make room for them. They're bonded to the back of adjacent teeth, which can fail. Bone loss does continue. There is diminished function. Chewing forces may loosen the bridge eventually. The lifespan can be anywhere from 5 to 10 years. A fixed bridge. Pros are they look natural, they're fixed, non-removable. They're okay if adjacent teeth need restoration or crowns. The cons: it does cut down healthy adjacent tooth structure. The adjacent teeth are more likely to experience tooth decay than they would have been. There can be food trapping underneath the missing tooth. Bone loss may continue, and the lifespan is probably 5 to 15 years. Another option is a dental implant. The pros: they look natural, they can stop bone loss, they're fixed, they're not removable. They replace tooth without damaging adjacent teeth. They're the strongest tooth in the mouth and can chew anything. They're not susceptible to further decay or gum disease. They're the most secure and stable option. The con: higher cost, and they may take longer to complete. So which tooth in this picture is the implant? So if we have several missing teeth, what are the replacement options? So for several missing teeth, most economical is a partial denture, also known as a flipper or a partial. They are the most economical. The cons are bone loss does continue. They are uncomfortable many times. They can irritate the gums. They move and shift when eating. Clasps may wear down the adjacent teeth. They are removable. They should be taken out at night. Lifespan is only 5 to 10 years, and they trap food and can cause bad breath. Another option is an implant-anchored partial denture. Pros: it does stop the bone loss in the area of the implants. There's no visible clasps. It increases function and comfort. Existing partial dentures may be able to be used. Increased stability and decreased moving and shifting while we're eating. The con: it is removable and should be taken out at night. Another option is an implant bridge. This stops the bone loss in the area. It's very comfortable, very natural looking. You can eat anything. It's a once in a lifetime type of solution. They're very stable, strong, and functional. They're non-removable, fixed, and they never come out. Con is the higher cost. And for several missing teeth, single implants. They're most like natural teeth in form and function. They stop bone loss. You can eat anything. They're non-removable and very strong and stable. The con: it can get expensive if you have multiple missing teeth. All teeth missing. If you have dentures and are not experiencing difficulties or bone loss, you are very lucky. However, if you have problems with your dentures, you are not alone. If you have dentures, what are you experiencing? Loose, slipping denture, electric shock pain when biting, goopy, bad tasting adhesives, embarrassing clicking sounds while speaking and eating, affected speech, reduced bone levels, looking and feeling older than you are, restrictions on the everyday pleasure of eating. So if all the teeth are missing, what are your replacement options? Obviously, removable dentures are one. The pro, they're the most economical. The cons, they're uncomfortable, can cause gagging, they interfere with taste, bone loss continues, the ridges flatten, they need constant relines as the ridge flattens, they move and shift with eating and talking, they should be replaced every 5 to 10 years. One option is 2 to 4 dental implants with dentures actually attaching to them with snaps. The pros, they're comfortable. The pressure of biting is more on the implants, not the gum tissue. There's increased stability. If you have more implants, it will equal better function. Can talk and eat comfortably. Existing dentures may possibly be used and retrofitted to accept the implants. Cons, they stop the bone loss only in the areas of the implant placement, and the denture is removable. Fixed bridges on implants. Pros, they're natural looking, they're not removable, they're highly functional, very strong, very stable. They stop bone loss, they're comfortable, they can last a lifetime. The con is they're more expensive. Another option is single implants for each of the teeth you're missing. The pros is like getting back all of your natural teeth, but better. Stops bone loss, and can last a lifetime. It's probably the best treatment option of all. And the con is it's unaffordable for most, and it may take significantly longer to complete. The hybrid denture option. Pros are these stop bone loss. They're not susceptible to further tooth decay or gum disease. They're a highly secure option, and they're about half the fee of multiple single implants. Am I a candidate? Age is not a factor. The answer is yes. As long as you're in reasonable health, you are a candidate. 3 conditions make you ineligible: HIV, pregnancy, and uncontrolled diabetes. What are the success rates for implants? They largely depend on the skill of the practitioner, the quality and quantity of bone. Generally, in the hands of a skilled practitioner, the average success rate is 98% after 10 years. This is considered a once-in-a-lifetime procedure. So what are the risks? Titanium allergy, which is extremely rare. Paresthesia, numbness caused by incorrect placements or by instrumentation of hitting a nerve in the lower jaw. Accurate pre-op scans and x-rays, and when needed, surgical guides are vital to avoid paresthesia. In our office, we don't place any dental implants anymore without 3D imaging. Here are a couple of examples of using images that we do in our practice on every patient that we're going to do implants on. The upper 2 images show an area where an implant's being placed, not impinging upon the sinus, the dark area above it, and having a maximum amount of surface area to create a really solid root for the tooth. On the bottom 2, we see the orange, which actually tracks where the nerve goes through the lower jaw, and then where we place the implant so that it will not impact the nerve and will have no chance of causing paresthesia. How long does implant treatment take? The implant placement itself takes approximately 30 to 60 minutes per implant. Full case completion may take from 3 weeks to 6 months, depending on the treatment plan, quality of bone, and the implant quantity. However, we can work it so you will never be without teeth. Does it hurt? Implants are placed under local anesthesia. Most patients report very little postoperative discomfort, and most go back to work the next day. Usually over-the-counter medication like Tylenol and/or Advil are enough. Sedation is available for those who would like it. Are implants expensive? Your investment will depend on the following: what you need and want, the severity of bone loss, the choice of replacement teeth. If lowest cost is your primary concern, implants may not be for you. Other options are available, as we have discussed earlier in the presentation. Will my dental plan pay for implants? Most plans are designed for preventive care. Annual plans usually capped between $1,000 to $2,000 of covered procedures. Depends on how the plan is written and what it covers. They are okay for Flex and HSA accounts. They may be a tax deduction. Payment plans are available, including interest-free options. Dental implant care. Regular 3-month hygiene appointments are recommended for long-term success. We will teach you proper home care. Depending on your home care and health of your mouth, we may promote you to 6-month hygiene visits. I'm interested. What's the next step? In-office consultation, records and x-rays, careful analysis and planning, treatment planning with you, the patient, and then finally scheduling treatment. Finally, people with dental implants tell us they feel better, look better, and live better. It's a life-changing experience for them. They can once again talk, laugh, and eat comfortably with family, friends, and coworkers, and no longer feel hostage to their teeth. They all say the same thing: I wish I'd done this sooner. For questions, contact our office, Lake County Family Dental Care, 847-362-6540. Or contact us on the web at libertyvilledentist.com. Thank you.